A very good afternoon to one and all. On behalf of IAP Digital Team, I, Dr. Alopi, welcome to all participants and welcome to our today's discussion, Dr. Jatin. District Sub Co-Coordinator Dr. Poonam Madam from Jamnagar District. I request to all participants, please subscribe our IAP YouTube channel and Facebook page for watching more and more live webinar. And yes, one more thing, if any participants have any doubt, they can write down in a chat box. At the end of the session, we will discuss. Thank you so much, all of you. Hand over to you, ma'am. Thank you.
Thank you, Dr. Alopi, ma'am. A very, very warm good evening to all. Myself, Dr. Poonam Damsania from Jamnagar. Today's topic is Principles of Management of an Acute Injuries. I introduces Dr. Jatin Patel, sir. He done his Masters of Physiotherapy from Bangalore and he is certified kinesiology tech practitioner. He is a certified human movement specialist and he done dry needling and vibration release therapy from Human Kinetic Institute, Singapore. He done training of IASTM, instrumental assisted soft tissue mobilization at Brazil. And he is now international course instructor from ISTTM. Currently, he is a course instructor of JP Rehab Academy, Surat. So without a delay, I hand over this webinar to Jatin sir. Jatin sir.
Yeah, thank you, ma'am.
Thank you.
So good afternoon, everyone. So here I'm going to start my session on the principles of management of acute injuries. So there are so many different principles people are using to manage the acute injuries. Like if I'm talking about the old traditional principle like rise and price. So what nowadays, why I'm taking session on this, what we want to change about the principle of management rather than using that rise and price. Or if you want to use that rise and price, it is okay. But I like to add something over the few points like rise means raise, ice, compression, and elevation. So during that rise, what about the value of that rest? What about the value of that ice and all the compression elevation? So rise and police and the love and peace. I'm going to discuss about the different principles of management. Like you can use that any protocol for it. So first discuss about the soft tissue injury. Many activities can lead to soft tissue damage or injury like ligament, tendons, and the muscles. Things are included in the soft tissues. It may result with the pain, swelling, and bruising and damage. So in the soft tissue injuries, like it's classified according to the injury level, like a sprain, tendonitis, bursitis, stress injuries, and the ligament strain and muscle strain and ligament sprain. So normally, what we are trying to use for soft tissue injuries in acute conditions like rise, price, police, and love and peace. So for rise, matlab rest, ice, compression, and elevation. And for price, we are just adding the protection like protect, rest, ice, compression, and elevation. Let's talk about the rise. So in that rise protocol, first one is your rest. Today we have a quite considerable amount of scientific experiment evidence that support the treatment approaching the proof that use of rest has been obtained from effective effect of immobilization on the muscle healing. That's quite right. Everyone talking about the we need to provide soft tissue injury. That's very effective, and according to the research, they said yeah, it's going to work over there. But then might be it's going to create some issues. So initial days we can apply some rest. That's quite okay. I can say according to inflammation like healing soft tissue like inflammation and repair and regenerate and the remodeling. So in the state of inflammation, yeah, we can keep it for rest. Then after in the stage of repair and regeneration, it's quite difficult to give rest on that time. So we have to mobilize that structure. So if I'm keeping it for more on rest time, the adverse effect of immobility can be minimized. We just try to minimize that adverse effect. The meaning of rest is relatively to the locate the injury in, but involve the function such as weight bearing or any other strenuous activity involving increase the blood flow to the injured part. That's why I'm suggesting that do not go for more rest. We have to go for some weight bearing exercise. In recent days, what we using the protocol for the total knee replacement. Initially, like I'm talking about my experience in the 2009 and 10. So that time the TKR patient supposed to get a further treatment after the 14 days, means after the stitch removal. But in recent days, same day they have a physiotherapy treatment. If the patient was operated in early morning like 6 and 7 a.m. So might be in evening like around 5 to 6. The therapist is going to visit and they are start about the few exercises because they know the role of the early soft tissue mobilization. For ice therapy, also known as a cryotherapy, that will help you to reduce the metabolism and cause the blood vessels contractions. This physiology change is slow and what I can say prevent the further important consideration. It will help you for early active range of motion exercises for initial period. Ice also decrease the propagation and the nociceptive inputs, so you can use for pain management. But if I'm keeping the ice more or less what I can say in the stage of repair and regeneration, then sometimes it's going to create issue for the soft tissue healing. So for longer time, we cannot use the ice. Uh, if you asking me about my experience regarding the how to use ice and when to use ice, then if you have a visual analog scale, in that visual analog scale, if you have a pain score which is more than 6 or 7, so to get the control on that pain, we can use the ice application. Otherwise, that body is going to be heal that area according to that normal soft tissue healing. So need to provide some what I can say long time for ice application. So however, applying the cryotherapy for the healing process and damage can be worsened if the blood flow excessively reduced, because we need a fresh blood if you want to get the proper healing in the soft tissue. So we have to increase the blood flow, because fresh blood, the meaning it contains a high amount of oxygen. So if we want the healing over there, then we have to push for blood circulation. So if you're going to apply more ice over there, then might be that ice going to reduce your blood flow on that injured part. So there is and another, if you're applying the ice for extended time, then there is a high risk of skin bone and the nerve damage. So might be they're going to create some what I can say kind of hypersensitivity in that area. So just try to avoid that prolonged ice application. Now for compression serves to prevent the further edema. Like in initial phase, like inflammation, we have classical 5 signs of inflammation like pain, tenderness, temperature, and swelling must be there. So during early time, swelling must be there. It will stay there for 0 hours to the 72 hours maximum. But being a physiotherapist, we want to reduce that swelling as well as possible. If the swelling must be there, or edema must be there, then that swelling and edema going to reduce your blood supply on that affected area. And if you restrict the blood supply on that affected area, ultimately there is a low oxygen, and that low oxygen create the further tissue damage, create the hypoxia, and they're going to cause a cell death. Because of that cell death in initial hours, if you have swelling like in the ankle joint, if you have small swelling, but after 24 hours, it will going to be increased. After the rest also, that swelling going to be increased. The reason is there is some edema on the extracellular fluids. So we try to use the elastic bandages, or you can use the instrument assisted soft tissue mobilization techniques that will help you to provide some compression on the swollen part, and we can drain that swelling towards the lymph nodes. So you can use elastic bandage, and there are so many different types of elastic bandages are available in market that you can use, and we have to apply it from distal to proximal with the use of that egg shape, or you can use any shape. It's a you, whatever things you want to do, but compression will help you to reduce swelling as early as possible. Once we get the control on that swollen part, so easily we can improve the blood circulation on that affected part, and that improved blood circulation will help you to jump on next stage like repair and regeneration. Then after that structure is going to be reviewed in the remodeling stage. In the third, they will get the strength and the proper ability to hold your joints, and you can feel my joint is quite stable. Now for the elevation will prevent the swelling by increasing the venous return. So normally for elevation, you can keep the leg just above the heart, or if I'm I'm talking about the lower limb, then it must be above pelvis. So venous return must be there. But rather than keeping just simple elevation, I will love to work on the ankle movement, especially for ankle swelling. We can encourage for calf muscle movements like ankle dorsiflexion and plantar flexion. That dorsiflexion and plantar flexion will help you to improve the venous return, and that improved venous return will give you the good contractions, because sometimes because of swelling you cannot get the proper contraction in your limb. So to improve that venous return, we can use this elevation. So now, what the difference between rise, price, and police protocol? So in this police protocol, like P remains same. We have to provide some protection to prevent the further injury in the damaged area. But there is a one change in this protocol. We are replacing the rest as a optimum load, like OL. So we love to use optimum load. I and C, it remains same. Like I's compression and regulation remains same. It will stay there, but with the use of standard criteria. Like we cannot apply the ice for longer time. Similar fashion for compression, we can use different techniques, but we have to work on that swollen area. And additionally, for longer time of what I can say, work on the swelling area, we can go for elevation. But there is a one small change in this. It's your optimum load. So we have to apply some optimum load over there. That I will explain how that optimum load will help you. Now, first one is your protection. Protection emphasizes the importance of avoiding the further injury. If you know that there is a person having already like a second grade ligament tear, so we have to provide some stability in initial days. Then after, if you had a good what I can say control and strength, then after you can allow your patient to do the vigorous exercises. This could be the main using the crutches to protect the injury. Like we can ask our patient or clients to let's walk with some crutches. We cannot give completely rest, or we cannot go for completely protections. So with rest, with protection, we can encourage them for some load over there. Like optimum load will stimulate the healing of the as a bone, tendon, ligament, and muscle, which required some stimulus healing. You know what the standard treatment for the osteoarthritis? Normally, people like to go for jogging if you fight with the osteoporosis. So what were they trying to do? Like normally your orthopedic surgeon or maybe physician, they're asking you to just go for simple walking, because that's strenuous activity. I cannot say that's vigorous strenuous, but mild strenuous activity will help you to regulate your calcium system. So this way you can provide the some stretch on bone, and that stress will help you to get the proper healing in that body area. So that this way you can avoid the osteoporosis. So similar fashion, if I'm talking about the acute injury, if you're providing some optimum load, I cannot say we can ask someone to jump on within 2 or 3 days, but we can ask them for slow walking that they can use. I can say partial weight bearing, and later on they can use the full weight bearing with some restriction in the range of motion, which if you want to avoid like more inversion, then you can prevent it. So this way we can go ahead over there. Then optimum load is done by utilizing the mechanotherapy and include the wide range of manual therapy techniques. You can use the crutches, we can use the braces, and we can ask our client to use the like they can go for weight bearing with the use of crutch and braces now. So what I mean to say, with the use of protection, we just encouraging the to provide the optimum load. The right amount of activity can help you manage the edema. You know how to control the edema. If you have injury around the knee joint, say because of knee joint injury, you will get some swelling. So during that swelling time, what we trying to encourage, we just starting with the isometric of quadricep muscle. We'll ask our client to go for press and release, press and release. So that press and release you're trying to use to reduce the joint swelling. How it will help you to reduce joint swelling? Because that press and release, it means muscle contraction, relax, muscle contraction, relaxation. So muscle contraction and relaxation will try to push your fluid towards your lymph node directions. So we need some muscle contraction over there. So in the joint healing technique, sometimes if we have swelling on the muscular area, so you are supposed to apply some needles over there and let's try to attach the electrotherapy model is like EMS, and we just using the electrode dry needling to create the artificial contraction in that muscle area, which will help me to control that edema. Or even with the ISTM, we can encourage the some force on that part, and then force will help you to reduce that swelling. Like as I explained, for example, if your ankle swelling, then we must go for calf contraction. That contraction will help you to reduce the swelling as well as possible. Right. Now again, for ice, already mentioned about the ice, why we are not keeping the ice for longer period, because longer period ice will going to, what I can say, inflammation to get the jump on a second stage, like repair and regeneration. And repair and regeneration only will help me to go on a third stage, like remodeling. So rather than restricting or stopping your inflammatory phase, we can reduce the symptoms. If you have good symptoms like pain and other thing, so you can reduce that symptom with the use of ice. But all ice application might reduce plateau, which you need to give the proper healing. And also, what I can say, going to delay your soft tissue healing. That's why I'm just avoiding the ice application. If you have pain, which is around 7 to 8, according to the visual analog scale, then only you can use the ice application. And for compression, we can use elastic bandages, we can use canister tape, or even you can use ESTM to work on that compression. And in the new concept, also we can use the flossing bands. That flossing bands also will help you to improve the flow towards the lymph nodes. So whenever we are going to apply any bandages or flossing bands, it must be towards heart. We are not supposed to apply away from the heart. Otherwise, you will not get the proper venous return. So if I'm talking about the upper limb injuries, then we have to start from fingers and going towards the elbow or towards the shoulder. It means we are going towards the heart. So this way we can work on that edema. Elevation, there is a role of elevation, but nowadays people just simply going to avoid that elevation. If you want to avoid that elevation, then you have to encourage for some movement, because we need some muscle contraction. That muscle contraction will help you to improve the venous return. If you don't have muscle contraction, then you have to rely on elevation. So in some patients, those who are, I can say, maybe some head injuries, they're unconscious. So in that unconscious patient, we have to keep elevation to reduce that swelling. But if they have like conscious and they have contraction available in your calf muscle, then you can increase the more contraction, will help you to reduce that swelling. Now the love and peace protocol. Normally what we talk about the price rise and the police protocol, mainly it's an immediate reaction after the injury, but it's love and peace. It's a main different. We can use it immediately after the injury and even for longer time, like for complete soft tissue rehabilitation, we can use this protocol. So what do you mean by peace? Peace malab protections, elevation, and avoid the inflammatories, and C malab compression, and E malab education. So PEC, peace. So in the peace, first one is your protection. Before this starting of the protections, I love to talk about the harm. So normally after the immediate injury, so many people try to apply some heat. So after the injury, we are not supposed to apply heat, or even your client or patient not supposed to go for drink. So we have to avoid heat, alcohol, running, and massage. Yeah, people sometimes think that massage will help me for pain reduction. That's quite okay. For process of desensitization, you can use massage, but if you have a hypersensitivity in that area. But for what I can say, for healing process or after the injury, if you are applying massage, then it's not going to work. So normally there is no need for any massage. So I say no harm after the immediate injury. P for protection, unload the restriction movement that minimize the bleeding and prevent the distension injury. It will help you to reduce the risk of aggressive injuries. E for elevation, that elevation will help you to improve the venous returns. A matlab, avoid the anti-inflammatory modalities or anti-inflammatory drugs. What we think, if you have some injury, so immediately you can apply, you can use the medicines. Like orthopedic surgeon nowadays, they are prescribing the medicine like NSAIDs. I'm talking about the diclofenac sodium, aceclofenac sodium, with the enzymes like cytopeptides. They believe that cytopeptides will help you to reduce the cell volume, right? But unnecessary. If you don't have much pain, according to the visual analog scale, if you don't have much pain, like it must be less than 5, then do not go for any anti-inflammatory drugs, because they all are anti-inflammatory drugs. And as I said about the soft tissue healing, if you're going to work on the soft tissue healing, then you must need to clear the inflammatory phase, then repair and regeneration, then remodeling. So if you want to complete the inflammatory phase, then we are not supposed to use anything which is going to stop your inflammation in between. So rather than using the anti-inflammatory drugs, I will encourage the inflammation stay there. If you feel the classical 5 signs of inflammation must be higher in that if you have a severe pain, because why I'm talking about pain? If you have pain, then might be pain going to increase your muscle spasm as your body going to activate the defense mechanism. So to get a control on that pain, you can go with NSAIDs. No, otherwise, no need for any NSAIDs. Same like compression, you can use kinesitape, you can use ISTM, or you can use bandages to work on compression. And if for education now, like we have to educate our patient that this is injury and it will stay there for like initially faced for inflammation for 2 days, after that repair and regeneration. Then after your third stage is your remodeling stage. So we need to explain them on which period they have to supposed to take a rest and when they need to apply ice or when no need to apply ice. So you have to explain them basic criteria. If you are simply suggesting them you have some injury and you have to take rest, then it's not going to work. So you have to explain them. You can go with some optimum load, like if you have injury in your rhomboids, so we are not supposed to restrict the other range of motion like your what I can say shoulder flexion and other things. So we can encourage some optimum loads. We are supposed to ask them for few movement which is not going to create any issues for your rhomboids muscle. So we have to educate them, and patient education matters a lot in any treatment, whether it be using any joint mobilization or any stretching exercises or anything. We have to explain each and everything to them. Then after this first days have passed, like I'm talking about the initial days. So now when you're working on the further process or progression, so in that time we are focusing on the load, optimum, vascularization, and the exercises. So for load, we can give some load which will help you to return your normal activities. Then if you want to return on your normal activities, you need to have some contraction in your muscle. How you will get some contraction in your muscle? For contractions, we have to apply some load on your joints and muscle. It will going to improve your muscle contractions. So this will going to create some optimization, and continuous contraction will help you improve the blood circulation, and you can improve some vascularities. And ultimately at the end, if I'm talking about the assessment, like any assessment, physiotherapy assessment at the end with the treatment planning. So in the treatment planning, we have 2 goals, like short-term goal and long-term goal. So in the short-term goal, our first goal must be to reduce the what I can say pain management. So first goal, we just try to reduce pain. So for that process, we can use the any modalities to get the control on pain. Then after, we can go with the other strength exercises in later on stage, like I'm talking about the long-term goal. So if we get the, I'm talking about the prognosis of any conditions. So to improve the prognosis of any conditions, we can work on the strengthening exercises. So load for activity approach for the movement and benefits for motor patient for the musculoskeletal disorders. So normally I'm talking about the acute injury which is related to MSK, musculoskeletal conditions. So mechanical stress should be added in early time to activity resume soon as symptoms going to be what I can say reduce or symptoms going to be allow you. So if you have a severe pain which is more than 5, then you are not going to encourage any movement. But if you have good control on pain, then we can go for some exercises. So pain, the word of pain will going to play a major role in this. So we have to work on the pain management, and according to pain, we can start our next procedure. So we can start about the loads and all that. Optimum the patient expectation associated with the better outcomes and the prognosis. If we are encouraging with some movements and all that, so this is a normal tendency of any patient. If we are asking them for any movement, so they must be going to believe in your treatment. They say, oh, it's quite okay. After my ankle sprain, I can walk over there. So this is about to working on the psychological factors. For vascularization, cardiovascular activity is going to help you. And even if I'm talking about the chronic conditions like tendinopathy, for acute time, you can say tendinitis. But when the condition is chronic, like tendinopathy, in that tendon going some, what I can say, degeneration of tendon. So in a natural way, if the tendon going to be degenerated, so in that area there is a low blood circulation. So with some specific exercises or with some specific methods, like with the ISTM or with the needle and with the cross fiber friction massage, we love to improve the blood circulation. Because this process will help me to regenerate the inflammation. If I'm talking about the chronic tendinopathy, if we want to remodel that tendon, then we have to again come back to the inflammation, then repair and regeneration. Then after, you can go towards the remodeling stage. So to remodel your chronic tendon like tendinopathy, we have to make it acute, kind of that, and it will help you to complete the soft tissue healing process. So for that process, we need some vascularity. For exercise, there will be a strong level of evidence that use of exercise for the treatment and ankle sprain, reducing the prevalence and the reoccurrence of injury. Yeah, if you want to avoid the reoccurrence of injury, then we have to go for exercise, because exercise only the best option to get the control on your joints and muscle. They will help you to provide some stability, because if you're going for exercise, then it will helping you to increase the amount of fibroblast, and fibroblast will allow you to convert the collagen 3, which is what immature and which was produced during the repair and regeneration, and during remodeling, that collagen 3 is supposed to convert as a collagen 2 and 1. I'm talking about the types of collagen. So if you have types of collagen in 2 and 1, then they both are very good for you to get the proper stability in your ligament, muscle, and tendons. So this is everything about my basic presentation on the, what I can say, principles of injury. If you have any questions, then you can ask me. I think there is something to you can ask here. If I get why we can't use anti-inflammatory resolution soft tissue injury disturbance. As I said, if we are using anti-inflammatory modalities in early time, then might be we are going to we can stop the inflammation, or might be we are going to disturb the inflammatory process. But if you have a pain over there which is uncontrolled, according to visual and our scale, if it must be 6 or 7, which is uncontrolled. So during that uncontrolled pain, your body going to be react, and they're supposed to start their, what I can say, defense mechanism, and in that defense mechanism, they're supposed to create some muscle spasm and all that. So to get the control on the pain, you can use any modalities. But if you don't have much severe pain, then we love to encourage the inflammation, because inflammation will help you to go on a further stage like repair and regeneration and remodeling. So for the proper strength of a tendon or muscle, we have to be there in the remodeling stage. So if you want to reach up to the remodeling stage, which is third, we have to clear first inflammation, and then second repair and regeneration, and then third one is your remodeling. When exactly we use the police and peace and love? Yeah. So rather than using rise and price, you can start with the police protocol. Then after peace, it seems like your police protocol. But later on, after the few days, I can say after 1 week, you can go with the love protocol, which will helping you to create some load on your tendon, muscle, and the bone. Can there be any soft tissue injury without pain? No, there is no soft tissue injury without pain. Yeah, but there must be variation in the severity of pain. So if you have less pain, then it's quite good. If you're larger pain, like it's more than 5, it's kind of, you can count as a severe pain. So we have to get the control on that pain. If I'm talking about the carnation taping, so for pain management, we supposed to apply a carnation tape. That tape will help me to lift the skin. Why we want to lift that skin? Because of swelling, there is some inflammation, and because of that inflammation is supposed to create the pressure on your nociceptors, and your nociceptors supposed to be increasing the fighting rate, and you will get the pain. So if you want to decrease that fighting rate of the nociceptors, then we have to apply the tape, and the tape will try to lift up the skin, and we just reducing the compression on that nociceptors. So this way your tape will help you that manage the pain. So rather than going for any anti-inflammatory drugs, you can go for tapes, and even allowed to go with tens. If you have pain, then allowed to go with tens, because tens having a strong management. To manage pain, my first choice is tens. So any kind of that we use it, but according to the conditions like acute condition and chronic condition. So in acute condition, here I'm talking about the acute condition only. So in acute condition, we have to use a high frequency TENS that will help you to block the pain of what I can say, with the use of segmental inhibition, that acute pain must be carried by the A delta fibers. So when I'm going to apply the TENS, they will help you to block the pain at the spinal cord level. Right. Any questions?
Yes, sir. Dr. Jatin gives a very good and clear principles about pain management at acute injuries. And we have always confusion when we apply ice and heat. That confusion is always clear by this webinar. And also what is the difference between RICE, PRICE and police protocol. When we do weight bearing exercises, when we do isometrics, when we do dry needling, when we do soft tissue release technique, that is also you cleared. And how we apply crepe bandage, compression bandage, and what we cannot do, that is a harm, that is also clear by you, sir. Any questions? Any questions, Priyanka, in the chat box? All have cleared, I think.
There
Yes,
are few
ma'am.
questions like 2 or 3 which are already answered, and that was a nice question because they have confusion regarding the NSAIDs and about the pain. So already I clear about that. Still, if you have any questions, then they can ask me. Anybody?
Any participations?
I think nobody is there. So not an issue. This is very emerging. I cannot say the emerging, but it's a very crucial and important topic to discuss about the management of acute injury. I cannot say the physios are not working on this protocols, but so many times I've seen that because I'm doing my practice since last 11 years in the physiotherapy. So supposed to have some reshuffle patients on one clinic to another clinic, and during that conversation with patient, I come to know they're simply using the ice in any condition, like whether it be acute, whether it be chronic, but in any condition they're prescribing the ice, and even patient is kind of that mentality. If you have injury, then go with application of ice, whether it be acute or chronic. So we have to explain them. So that's why in the love and peace protocol there is some topic like of education. We have to educate our patient. This way we can prevent the chronic conditions. We just try to solve in acute time only.
Okay, sir. Any sir, any cases you discuss with you that is come with acute condition, acute injury, and you solved with I think your dry needling is a very clear and
effective. Yeah. So for acute conditions, I'm supposed to use my simple protocol, like for decurrence syndrome. I'm used to apply a thumb spicaspline for initial 2 or 3 days. Then after, I'm supposed to ask them to come for follow-up after 3 to 4 days. They come to follow up with the complaint of that, oh, I don't have much pain, but still I have something that it means it's below 5, and they are getting a good control on, I can say, pain on that part. So initially for any injury, we can provide some protection for first 1 or 2 days. Then after, we can encourage some movements that will help you to improve the blood circulation, and you can work on your repair and regenerations. Right. So in the same time, in chronic condition, I had one patient. She was suffering with tennis elbow in acute time, but she just sent me the photographs or that consultation of the orthopedic surgeon, and orthopedic surgeon suggested them to, what I can say, work on the physiotherapy treatment. Then she can taken physiotherapy treatment somewhere else. Then after, again, like after 2 months, I guess, yeah, she came at my clinic with her mother-in-law for the knee pain. And that time I asked her, okay, what about your elbow? It's still paining? She said, yeah, it's still paining. So we educate her. So this is right time to work on your tendons, because you left that initial phase. I cannot say you have right now in acute tendonitis, but right now it's going to convert as a tendinopathy. Even she consulted one orthopedic surgeon, and that orthopedic surgeon supposed to ask them, they already instruct her, might be she's going for surgery over there on that chronic tennis elbow. But with the instrument assisted technique, we create some inflammation on that part, because with that ISTM, we create some specific trauma on that tendon area, and that will help me to improve the inflammation, and that inflammation will helping me for repair and regeneration, and third stage is remodeling. So after a treatment of what I can say 15 to 20 days, she's quite fine now, and it's a blessings of physiotherapy. She didn't underwent for surgery, and she's quite good right now. So there are so many cases that we can solve with simple our basic protocols.
Okay. And sir, for ankle sprain, one sports person who are coming with ankle sprain, I think RICE protocol is used in that person.
For ankle sprain, initial time we can use a RICE protocol, but after 2 or 3 days, we are supposed to ask them for some optimum load rather than keeping only in the what I can say rested position. Yeah, but if you have a severe ankle sprain, like during your assessment, if you know there is a grade 3 ligament tear, then they need rest. But if it will be 1 or 2, then we can engage some movements and all that.
Okay, sir. Anybody else who asked want to questions?
Acha, I think somebody is there. So thank you so
Okay.
much, Indian Association of Physiotherapy Women's Wings, to invite me for this session. Full to Dr. Poonam and Dr. Priyanka and the team of Jamnagar Women's Cells of Indian Association of Physiotherapy and entire Gujarat IAP cell and enter ED IAP cells. I was a member of IAP team of Gujarat, and right now I'm presently chairperson for fundraising committee of the Western India. So still I'm a part of IAP, but IAP have initiated wonderful wings over there, which is going to work on the IAP women cell, because more or less in the present physiotherapy population there are so many females, and we have to respect that female, because about the physiotherapy admissions in the college, so parents used to have a one query, sir, मेरी जो लड़की है वो physiotherapy में काम कर पाएगी, because what they think it's a laborious job. This is not at all a laborious job. So few female physiotherapists who is not working only just clinical setup, but they have a very good hands in the sports conditions. Even they have a very good hands in the pediatrics. So I have a lot of respect for female. They are working in each and every field. If I'm talking about the as a comparison of male, then female did a wonderful job in Indian physiotherapy field since last so many years. So thank you so much, IAP, and I hope you will continue this kind of session, because this session will help you all the students of physiotherapy to get the new era for the working on your patients. Okay, thank you so much, doctor.
Thank you, Dr. Jatin sir, and also thanks to event organizer Dr. Ruchi Vashni, Dr. Pooja Kamble, Dr. Devangi Vaishnav, Dr. Bhavna Gadvi, Dr. Alopi, and all technical team. And I also request to all to please subscribe IAP WBC Women Cell. Thank you. Hand over to Dr. Alopi.
Thank you so much, Jatin sir. It was actually very informative session. Thank you so much. And congratulations, Jamnagar team, for successfully conducted webinar. Last but not the least, thank you so much to all participants who joined and make it successfully. Before end this webinar, my big thanks extend towards our IAP president, Dr. Sanjeev Jha sir, and our IAP treasurer and IAP Women's Cell National Head, Dr. Ruchi Vashne ma'am, for providing a platform for all of us. Thank you so much, all of you. Before end this webinar, I request to all participants, please subscribe our IAP YouTube channel, Facebook page for watching more and more webinar. Thank you so much. Have a nice day. Thank you.